For the active assistive exercises using a stick, what you can use is a broomstick, a cane, PVC pipe, a branch off a tree, anything that you'd like that you can get both hands on and is long enough to give you the motion that you need. Today I'm going to talk to you a little bit about some stretches for the shoulder. If you have rotator cuff injuries, maybe post-surgical, and you need to do some passive range of motion exercises into some active assisted range of motion exercises post-surgery before you are allowed to actually use your arm will usually be in a sling in this instance. And also if you have just some stiffness in the shoulders that you want to improve your range of motion to help prevent frozen shoulder or just an old stiff shoulder. The more motion you have in a joint, the more lubrication that joint's going to have and the more health it's going to have to it. So I always like the saying, motion is lotion. So the more motion you have, the more lotion or lubrication you have in those joints to help it. So you can use a stick, you use a wall. I'm going to show you a couple passive motions first you can do with the stick. One of them is an internal rotation. So if you get your arm behind your body, you can use a towel for this as well. And you take and pull, you're pulling up with this hand here, and this hand down here is just going along for the ride. So that's more passive. You can also do an external rotation motion with it by just keeping your elbow on your side and pushing it out like this. You can do that laying down as well on your back, or you can do it against the wall in a corner by just getting your arm up here like this and leaning in towards the wall. If you lean in towards the wall, that really gets a good stretch in the shoulder and across the pectoralis region there. Or you just go against a wall like this or against the edge of a wall, the corner of a wall, and stretch like this, keeping your elbow and your forearm against the wall, turning back. Those are some passive exercises. Some active assistive exercises, meaning you're using something else to assist your motion. Again, you can use the handy dandy wall, and you can go up the side, called wall slides, going out to the side like this, like you're raising your arm up like you're doing a jumping jack, or you go forward. Okay. And then you can also use the stick for a little less assistance than what the wall would give, so it's using your muscles a little bit more. You take the stick and you raise it up. What I'm doing, for instance, if this shoulder is the one that's tight or injured, I'm using my right arm through the stick to assist the raising of the other one. Okay, just like that. Again, this is an exercise you can do laying down on your back as well. And you can take it up out to the side. Like so. Okay. What I would generally do is repetitions of this, say 10 to 15, depending on how it's feeling. If it's getting better with each one, you keep going. If you can, if it starts getting painful or more tight, don't persist. Don't pursue that any further. But it should continue to get better as you keep causing more motion in the joint.